Hey guys, welcome back to our channel Week Megha. Myself Upasona Panday. I'm a second professional MBBS student from NILRATAN SIRCAR Medical College and Hospital. So this is our fibula, the lateral bone of our leg. That is our post-axial bone. Okay, this bone is quite slender and thin in compared to that bulky and enormous tibia. This articulates with the tibia on this upper end, and on the lower end this forms the tibiofibular mortise where the head of the talus fits. So this fibula does not take part in the knee joint but forms the ankle joint of our body. The fibula, this is a long bone. So its parts are obvious. One upper end, one lower end, and an intervening shaft. Now let us decide the upper end and the lower end and look at their features a bit more closely. So this is our upper end. How do we locate our upper end? This upper end is expanded on all sides. All sides this is expanded rather than this lower end which is expanded anteroposteriorly. Okay, so this which is expanded on all sides, this is our upper end. It presents three features. There is a oval articulating facet that articulates with the lateral condyle of our tibia. This is the oval articular facet. This is our styloid process that faces posterolaterally. Okay, we will determine its side, then we'll look that this styloid process faces posterolaterally. For now, let us assume that this faces posterolaterally, and then in front of this styloid process there is a anteriorly there is a sloping surface. Okay, so this is our articular facet, this is our styloid process, and this is the anterior sloping surface. Now let us go to the lower end. The lower end, this is expanded anteroposteriorly. This is expanded anteroposteriorly and presents a expanded lateral malleolus. So this is our expanded lateral malleolus. We turn this medially. Obviously this is our lateral malleolus. Opposite to it will be the medial aspect. So let us turn this medially. We'll find here the triangular articular facet that forms the tibiofibular mortise where the head of the talus fits to form the ankle joint. We remember the similar part of the facet on the tibia, and this is the similar facet on the fibula that forms the tibiofibular mortise. And in between this articular facet and this lateral malleolus there is the malleolar fossa. This helps us determine the side of the fibula. We will look into the trick. Now let us look at the shaft. In the shaft we will find three borders and three surfaces. So let's start from this lower end. This is our expanded lateral malleolus. Okay, from the two ends, anterior and posterior ends of the lateral malleolus, we will see that, let us look it closely. We'll see that two lines goes up and joins almost in the, from the lower end it is almost 1/4. It joins to form a border which is prominent in its medial part, and it fades in the upper 1/4. This is our anterior border. So the anterior border in its lower 1/4 splits into two to cover this lateral malleolus. Now we turn this thoramedially. Thoramedial, so that we can see this triangular articular facet. We will find that leaving a small gap beside this anterior border, we are finding another SIRC border. This was our anterior border. Thoramedial to this, we'll find the medial or the interosseous border, which becomes prominent from this lower 1/4, and it is prominent throughout its course till the upper end of the fibula. And there is just a small gap in between this anterior and the medial border. Now we turn this more medially, okay, so that we can see this malleolar fossa. So this is our posterior aspect. We will look into it, okay. This was your medial border, and now there we will find one oblique line. This may or may not be present in all bones. Then we look into the next line. We find this another misleading line, but which is not a border. This another misleading which is prominent in this middle part. This is our median crest. We turn this more towards our malleolar fossa, and we will see that one border emerges, starts just in line with this malleolar fossa and goes all away, all along this shaft of the fibula, and it goes pura upar. This is our posterior border. So we have find 3 borders and 2 misleading lines. Some of you may find one misleading line, that is the median crest. So let us once look at this. Let us turn this to the side of the lateral malleolus. Then we'll see these 2 lines. These 2 lines joins to form the anterior border. Thoramedial to this is our interosseous or the medial border. Then thora, turning it posteriorly with this, we get this oblique line. Then we get this median crest. Then starting from this malleolar fossa, we get this posterior border. So we are clear with those borders. Now we look into the surfaces. Let us again turn this to the lateral malleolus. So this is our anterior border, and this is our interosseous border. In between this anterior and this medial border, we get the medial surface, which is very narrow. That this is the narrowest surface of all the 3 surfaces. We turn this medially. We get this is our medial border. Then this is our median crest, and this is our posterior border. So this is our posterior surface in between the medial and the posterior borders. This median crest, which misled us while finding the borders. This median crest divides the extensive posterior surface into a anterior concave part and a posterior flat part. And these have their separate attachments, which we will look into separate video. Okay. Now this is our posterior border, and this is our malleolus, the lateral malleolus. So this was our anterior border. So in between this posterior and the anterior border, we get this lateral surface. So we have seen about the 3 surfaces and the 3 borders of the shaft. Now our work is to find the anatomical position of this fibula. Let's look at that. So this is the fibula. We need to hold it in the anatomical position. So this was your upper end, which is expanded on all sides. This is the lower end, which is expanded anterior-posteriorly. Now the features of the lower end are this articular facet, the malleolar fossa and this lateral malleolus. We have already said all of this. Now how we will hold this? We will hold the fibula we'll place our thumb in this malleolar fossa. Let us place it. We can place it like this. Okay? Or we can place it like this. We can do it with both hands. Now, in which hand will we hold this? We need to hold this such that this facet faces anteriorly. So let us hold with this hand. In this case, you see the facet, this faces posteriorly. So we should not hold it like this. We should hold it with the opposite side. So after holding it with our right hand, we find this articular facet faces anteriorly. We need to hold in such a way that this malleolar fossa will be directly posterior. This is just directly posterior. This is our anatomical position. You can hold this like this, okay? Or you can simply hold this like this after finding the side of the fibula. I used to hold it like this. Now we'll match some of the features, okay? Let us look into the upper end. There are 3 features. This is the articular facet. This is our articular facet. This was our styloid process and this is the anterior sloping surface. We said that the styloid process should be facing posterolaterally. Okay? So, let us hold this and see. You see this styloid process, this is facing posterolaterally. Okay? Now let us find out the anterior border. See these 2 lines join to form this anterior border. Thoda medially, this is our medial border. Then this is the oblique line. Thoda or posterior, this is the median crest. And this is our posterior border which starts right from this malleolar fossa. So, we have hold this in anatomical position and find out that this is our right fibula. Okay, now your duty is to comment below and let me know which sided fibula do you have. Till then, take care, tata, bye bye.